Namaskar, I am Dr. Shipra Kunwar and I am working as consultant gynecologist at Manipal Hospital Kharadi, Pune. And today I'll be talking about a very common question which women ask: exercise during pregnancy. What exercises to do in pregnancy, and is it safe for me to do exercising during pregnancy? These are the two most common questions with which women come to us during pregnancy. So the first answer is yes, it is safe to do exercises during pregnancy. In fact, it is good if you exercise during pregnancy. However, you should always consult with your gynecologist before starting any exercise. Also, if you have been exercising prior to getting pregnant, you should continue with them after discussion with your doctor. And if you're starting new exercise, then it is advisable that you start slowly, like start for 5 minutes every day, then slowly increase it to 10 minutes, 20 minutes, and slowly to 30 minutes. So what is the ideal time of exercise, or how much exercise can you do? So according to the guidelines, it is said that 150 minutes of exercise per week is advisable for women. So that 150 minutes is per week comes to around 30 minutes per day for 5 days a week, and that is sufficient to keep you active. Now, what exercises can you do? You can do any exercise in which there is no risk of fall, and also if there is no contact, like in which, like boxing or surfing, in which you can fall and hurt yourself. Also, if you're doing yoga, it is advisable not to do inversion poses, or balancing too much, maybe standing on one feet, in which there is a risk of fall. Otherwise, you can go in for running, you can do swimming, you can do walking, and of course yoga and Pilates under supervision. So what are the benefits of exercising? The benefits of exercising are: it improves your mood, it keeps you active throughout the day, it prevents gestational diabetes from developing, keeps your blood pressure under control, it also eases constipation, it improves the joint mobility, and also it helps as a byproduct in, if you're going in for normal delivery, it will help you during delivery. So what caution should be exercised, or what precautions you should be using while exercising? So you should not be doing it in a too hot atmosphere, or even a lot of changes in the weather, like too hot or too cold, and you should be wearing comfortable loose fitting clothing that will help you while exercising. Wear a good bra that will give you good breast support. Wear a maternity belt after asking your doctor. Also, keep yourself well hydrated. Do not overdo exercising. How you can know that you are not overdoing your exercise? You can do the talk test. So if you are able to talk while you're exercising, you're not overdoing it. Also, which women should not be doing exercise during pregnancy? Those women who have a condition known as placenta previa, in which that the placenta is low down, if you've had bleeding, if you have pain lower abdomen, if you've had miscarriages earlier, if you have a condition known as incompetent cervix. In these conditions, it is advisable not to do exercises. So I would suggest that exercise is good, but it should be always supervised. Do not overdo it. Do not use very heavy weights, and always consult your doctor before starting your exercise. Thank you.